Hi, I'm Dr. Mark Surrey. I'm a board-certified reproductive surgeon specializing in infertility treatment. I was born in the Washington, D.C. area and grew up in suburban Maryland. I attended a prep school there and went to undergraduate school in Western Pennsylvania in Pittsburgh. Went to medical school in Washington, D.C. at George Washington University Medical School. Attended UCLA for my residency and was at the University of London and at Monash University in Melbourne, Australia for a fellowship in vitro fertilization. In London, I had the privilege to be mentored by a Professor Robert Winston, who's subsequently been knighted for his involvement in the early aspects of development of microsurgery and reproductive surgery, as well as in vitro fertilization, and was privileged to begin my fellowship there and take more training in that area, particularly in vitro fertilization, with a Professor Carl Wood in Monash University in Melbourne, Australia. These were the centers at the time, which was roughly about 30 years ago, where the most significant work clinically and scientifically in our field was being developed. Well, I was in my training initially leaning toward oncology surgery, and that's cancer surgery, which was technically very interesting, but unfortunately the outcomes were sometimes not favorable, and people would actually not do well sometimes with cancer. As you might imagine, it can be sort of depressing if you get personally involved with patients, and I like to get personally involved with my patients. And when we look at reproductive medicine, the outcomes are frequently more positive. It's much more interesting as well as appealing to be on the end of a positive outcome. I think the thing that I enjoy most about my job is when I get cards and pictures from patients who have been successful and are grateful for their new lifestyle with their new family. They attribute to our involvement in their care, and this is something that's very rewarding to us. We started the in vitro fertilization program directly through the university medical centers, and we're able to build a facility here to accommodate both UCLA and Cedars-Sinai patients as well as our own private patients, and have developed one of the premier centers in the world here based upon the ability that we've had to provide technology and personnel that are really second to none. And as such, we've become one of the leading institutions in the world with the procedures that we perform, their results, and have actually contributed significantly toward the scientific literature. We've been privileged to provide more abstracts than any other private program in California toward national and international meetings. We help train the fellows from UCLA and Cedars-Sinai, and so we very much enjoy our position in education and research in our field.